If you think bird dog is a beginner exercise, you're probably doing it wrong. Hi, I'm Vishav, a postpartum coach, and I help mothers regain their strength back during and after pregnancy. And if you want to progress into bird dog most effectively, there is a breakdown you need to follow before you start doing the complete bird dog. I'll show you how to go from an easy variation to a difficult variation without breaking your form or losing core tension. What I see people normally doing, arching their lower back, holding their breath, pushing their belly out, and losing balance. And this defeats the purpose of bird dog. So if we talk biomechanically, this movement is supposed to create core stability as your leg and arm move in coordination. And this is how your core needs to work in daily life as well. This movement teaches you pressure control, rib pelvis stability, and safe load transfer across the movement, which is crucial to regain, especially when you're dealing with issues like diastasis recti or pelvic floor dysfunction. And not only this, it's a foundation for real life loading like lifting babies, lifting groceries, even lifting weight at the gym. So let's get on to it. So before you start bird dog, you need to work on controlling your pelvis back and forth. So if you're not able to control your pelvis, you might be stuck in this position and might end up doing bird dogs this way, right? So you have to focus on bringing your pubic bone up towards your head and pushing it back, up, pushing this back. The more free your pelvis is, the better this motion gets. And if you feel that you have a hard time getting this motion in place, then you need to work on releasing the muscles of your back so that they can help you activate the muscles in the front. One of the best ways I love doing it is keeping my feet on the edge of a sofa or a wall and then working on mobilizing the hip while pushing my heel back into the wall and creating a few pelvic tilts. Once you feel that this motion is free, then try to create alignment. So your rib and your hip, they have to stack on top of each other to be able to help manage intra-abdominal pressure well. First, create tension across the midline while doing this movement. So you inhale into your ribs, relax your pelvic floor, breathe into your back, exhale, lift your pelvic floor, create some tension in your lower abs, hold that and breathe back in, relax the pelvic floor, breathe into your ribs, exhale. Let's do it for 2 more breaths. Breathe in. So you can see I'm not pushing all there in my belly. So I'm trying to breathe laterally. Exhale. Inhale. Exhale. Inhale. You can relax. So once you are done with this, hands and knees breathing drill, then we can progress into arm lifts. So here we need to just make sure that your hands and your knees should be on the edges of that rectangle throughout, and you can inhale, exhale to create a bit of tension across the midline and just lift your arm up and come back. Lift your arm up, come back. So I'm not shifting my body weight, I'm not letting my back arch, maintaining neutral pelvis position. I'm just lifting my arm up, coming back, lifting my arm up, coming back, lifting my arm up, back, arm up, back. If you have severe diastasis recti, you can avoid this position. If you can see a dome in your belly, you might have to do an elevated modified version. But if you are okay creating tension in your midline, you can probably work with this variation. Up, come back, up, come back. Now adding a little bit of difficulty here, we will start lifting your knees off the ground. You can inhale, create pelvic floor lower ab tension and lift your knees off the ground. Hold 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. Breathe in. Hold up 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Again inhale. Hold 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. You can see this. I am not pushing myself too much off the ground, just like 1 inch off the ground. And I'm also not letting my pelvis arch. Keep pressing the floor away. Create a good alignment while doing this movement and then relax. So this is number 3, lifting your knees off the ground in a beast hold, or you want to say quadruple knee lifts, whatever feels good to you, and relax. Adding on to the challenge of sliding, like adding on the leg movement part. So once you feel confident with the lifts and the arm movement and you're able to maintain your balance, now we can start moving the leg. A lot of people would struggle with the leg part because normally what I see people, they would shift a lot of body weight to move the leg and arch on the way. So bird dog is an anti-extension and anti-rotational movement, right? So we have to be able to stay. Okay, imagine that you're staying between 2 walls. You have 2 walls running parallel to you and you should not be banging into the walls. Okay, so you have to make sure that whenever you move your leg, you should be able to push the leg straight out and come back. So one variation I love for this is just sliding my foot on the floor. Inhale, create a bit of tension. Exhale, slide my leg out straight and come back. So not sliding here, not sliding here, and not letting my back arch. Just keep neutral pelvic position. Slide out and in. Slide out and in. Out, in. So you can try both sides. Out, in. Make sure you're not breaking this form, and straight from head to tailbone and just letting your leg move. Once you're comfortable with this variation, now we can try adding an arm to it. So you inhale, slight tension in your core, lift opposite hand, opposite leg without letting your back arch, belly get the entire pressure. You should lift, feel the lift in your lower abs, rib and hip connected. Slowly come back, out, back, out, back, out, back. So here I'm just maintaining tension and counting. You don't have to hold your breath. Repeating on the other side. Out, back, out. You can see how much of a straight line I'm able to maintain without letting anything move here. Not even shifting, not even dropping. Just make sure that you straight go out and in, out and in. So next, now try the complete bird dog, thinking you have a block on your back. Now when you're confident enough to create stability, inhale, slight core contraction, and then try to lift your leg out, come back in, out, come back in. I am maintaining neutral pelvic position. Think as if you're like a rubber band. Somebody is pulling you from here and from the tip of your toe, stretching out straight. Activate your glute. You should feel your glute activation, core activation, and it's an opposite. It's just working on opposite hand, opposite leg. So the entire back sling of your body is activating to keep you stable. Back, reach, back. You repeat on the other side. So when I come back, I'm not literally shifting off a lot. I'm maintaining body balance in the center. Hold, come back, hold, come back, hold, come back, hold. One common mistake I see people doing is dragging their knee. So try not to drag your knee when you're doing this movement. So keep your knee hovering off the ground and come back. Alright, so now you've completed steps to reach an ideal bird dog. I'm going to give you 2 more progressions from here. So if you feel confident enough to do these movements, you can always elevate your knee with something, hover off, and try to create little more stability from the block. on the floor. It'll add a little more balance challenge, and obviously your core has to work a little harder to keep you center. You can always add a band around your thigh to create a little more resistance. So here my right thigh has the band and the left hand has the band. So I'm gonna, once I feel confident with the bird dogs, I'm gonna progress into this banded version, creating contraction and pushing my knee, hip straight, arm straight, slowly come back, progress, slowly come back, progress, come back, maintain balance, come back, come back, come back. The added resistance definitely pushes this movement to become more challenging. If you found this useful, subscribe my channel, give me a thumbs up, and let me know what movement you want me to cover next in my next video.